Hey everyone, Happy New Year. Today I've got a special guest, Dr. Lei Chu. She is a urologist, a mother, and now an author. So I'm going to share with you guys a little bit about her book she just came out with called IVF Diaries. So Dr. Chu, why did you write this book? Who is this book for?
So I went through several cycles of IVF because we had a lot of difficulty conceiving and we really want to be parents. IVF was a big maze. Nobody explained anything when we go through IVF. We just kind of listened to the nursing staff and the doctors, and I was really felt there was really very little guidance along the way. There are so many factors. And main thing about IVF is reproductive endocrinology as a field is very different from other fields in medicine. As you know, in urology, we have normograms for kidney cancers, kidney stones, prostate cancers. We can tell the patient before surgery, before any treatment, how likely the success of treatment would be. How easy this will be to remove the stone, how successful surgery will be for kidney cancer or prostate cancer. But in reproductive endocrinology, that is very lacking. You can be the same patient, but going to two different doctors, have two treatment plans. It's completely different. I went in there into IVF not knowing anything. I felt blindsided. I felt I wasted a lot of time, which for anybody, any woman going through IVF, time is not on our side. I felt like I wasted a lot of time, energy, money, trying to guide through this maze that honestly I felt like I should have more help on. So this book is really my giving back to the community who have helped me a lot through this process. There are a lot of women along the way who helped me understand the process of IVF, what to expect, how to deal with failures. There was so much disappointments in this process. You really have, that's why we call this women warriors. I mean, IVF is not for the lighthearted. I felt this is me giving back to the community of women going through IVF, that this book can offer some knowledge and experience to help other women navigate through this maze and to avoid making the same mistakes I have, and to save their time, energy, and money, and to achieve the sacred goal of motherhood sooner.
Yeah, so along those lines, with kind of your unique perspective as a urologist and physician, I guess what are some of the things that were kind of surprising about the whole process that you wish people knew?
Yeah, as urologists, we treat men with fertility issues. We always order a semen analysis, a hormone profile. We do a physical exam. But when my husband, when we have trouble with conceiving, I did all this tests on my husband, and what really surprised me is that for male factor infertility, there are some guidelines, but it's really not very much. And what I felt was different is, as a patient, I went in expecting the men having to contribute a lot to this process, and it turns out most of the work are done by women. We have to do the injections. In my case, my husband gave me injections, but we have to get the injections, and we have to bear the side effect of the injections. We're the one who go through the process of all the different procedures. So that to me was surprising. I mean, in medical school, in residency, we hear of IVF. We just thought, oh, it's both men and female, both men and women are participating in this process, but most of the time it's women who bears most of the burden, number one. Number two, when we order semen analysis, we say, 3 to 5 days abstinence, but nobody tells you that when you actually give the specimen on the day of egg retrieval, the more fresh the specimen, the better. We had to learn this on our own. I had to do my own research. I understand, the fresher the sperm, the better the results for fertilization most of the time.
And then kind of along those lines, I know men are often asking about like supplements, like what are things that they can take that will make their sperm like stronger or better? What across kind of the research that you did through this process, like what supplements did you find value or seem like there was good evidence that it was helpful?
Yeah, so I like to talk about supplements, but I also like to talk about diet as well. So the supplements, there's a very famous book in the infertility world, IVF world, called "It Starts with the Egg." I followed the book to the T, but I'm not sure it really helped that much, to be honest. But I felt that few supplements mentioned in the book were helpful, including ubiquinol, which is a more bioavailable form of CoQ10. So ubiquinol, taken 200 milligrams twice a day, actually is a lot more absorbed through the body and more useful in terms of as an antioxidant. Basically, all the supplements do is just reduce inflammation in your body to improve the eggs and the sperms. So ubiquinol can be taken by men and women. Vitamin D3. Unfortunately, in Houston, it's so hot. Everybody's vitamin D is low. For fertility, it's recommended for both men and women to have vitamin D levels of at least 50. So supplements accordingly. Also vitamin E and high dose vitamin C, at least 1 gram a day of vitamin C. Those are things that kind of reduce the inflammation. As you know, the most common male factor in fertility of sperms is low morphology. And it's also the most difficult to treat because we don't know what causes low morphology except chronic inflammation in the body, which leads to diet. In my research, I visited several top IVF clinics in the country. One of them is CNY, and it's a very famous clinic in Buffalo, New York. They will basically do any protocols that can help any women. They individualize protocols. They will do cutting edge technology, but they will really try everything that you want to try. They're willing to give it a chance. Even though their success rate based on the CDC data may not be the highest, but I feel like they really give their best effort, the physicians and the staff there. So one of their founders of the clinic basically believes in high protein diet, protein, fat, and low carb in terms of reducing inflammation. I did a sort of a modified Atkins diet during fertility to decrease inflammation in my body, but I also tell a lot of my patients, especially men who have low morphology, to reduce chicken, reduce beef. And as we know, in America, unfortunately, chicken and beef have a lot of hormones and antibiotics. As a community of urologists, we've never seen so many young men with low testosterone and fertility issues or erection issues. They're presenting in their 20s, 30s with those issues, and part of it is really just diet. So I tell a lot of my male infertility patients to reduce chicken, reduce beef, really cut it out. No smoking, including cigarettes and marijuana. Reduce sitting. I think sitting leads to a lot of inflammation on the prostate, which can lead to inflammation in the sperms. And I also recommend that regular intercourse, ejaculation 2 to 3 times a week. It really does help in keeping the sperms fresh and reducing inflammation in the sperms. I recommend highly avoid soy products like tofu, soy sauce. As Asian, of course, that was difficult. But also things are good are, lamb from Australia, because, if you know me from Australia, it's just cleaner. And wild-caught fish, not farm-raised fish or shrimp. Those things are small tweaks you can do, but I think that in the long run, it does help a lot.
Yeah, no, that's really helpful to have such concrete advice on what to eat and what not to eat. And then my final question is, in your book, there was a chapter sort of the psychological impact of the whole IVF process on the guy. Can you kind of share a little bit about that, since as a urologist you kind of see that, but then as a female, you're kind of the person going through the process.
Sure. Yeah, it's difficult. I mean, I think a lot of IVF clinics fail to focus on this. Every IVF clinic I've been to, every physician I've visited, I've always addressed just the medical side of things. I never, no clinic has ever addressed the psychological impact of the process on the marriage, on the partnership, on the woman herself. I think, going through fertility really takes romance out of lovemaking, first of all. Um, that was definitely difficult. Second thing, I think is um, part of it is when there's difficulty and disappointments, sometimes partners can blame each other. When it comes to it, the goal is to achieve a child through both of you. I mean, really, a child is resolved your love for each other. But sometimes the process is so difficult that partners end up having, arguments. And my husband and I certainly have played the blame game during this time. But I think, my husband is such a big-hearted person that it only made our marriage stronger. But I think as a woman going through this, there was a lot of disappointments and heartbreaks along the way that I said in my book, besides residency, this is the second hardest thing I've ever had to experience. And I wouldn't wish residency on anybody. As you know, it was such a difficult experience. But this is almost just as difficult and heart-wrenching. And it's a residency, you can work harder and be better. But when it comes to infertility, you have basically no control over it. Very little control. We prayed a lot. And we really asked our church friends to pray for us as well. We really give up to God. But there was a lot of sense of being lost and powerlessness, and to deal with the disappointments and heartbreaks. There's only so much a person can really endure when it comes to negativity and adequacy as a woman, right? So when it comes to motherhood, a lot of women feel like if you cannot achieve motherhood, you're inadequate as a woman. And many of women going through IVF unfortunately have to feel that way. It's not right. Because it's not really in our control in those instances. But unfortunately, that's part of the psychological impact. And this book addresses that. And I want women to feel they're not alone. A lot of times when I went to IVF clinics as a patient, nobody ever talks. Like there are women sitting everywhere, several seats from me, but we never talk. None of us ever communicate. And I just wish we could talk more, support each other more face to face. To know that you're not alone. This is not a lonely journey. That many of us, and even I personally have known several colleagues who have gone through IVF. I've known numerous patients who have gone through IVF. It's a difficult process, but we should share positive stories, understand we're not alone, and emphasize that feeling lost and helpless is normal, but understand there's hope, and understand knowledge and support from your friends and family are the things that will give you that hope and positive feeling.
That's wonderful. It sounds like it was a really challenging experience, but a happy result at the very end. So
so we were blessed to have 2 children. So and one girl, one boy. We couldn't be happier. I think that we were certainly blessed. There are still a lot. That's why I felt like the strong urge to really write this book, because there are a lot of women still struggling with this, and including several of my really good friends. And I just want to give something back to the community to help other women, to know there are things we can help to make the journey more smooth. And is a copy of my
book. Please check it out. Well, thank you so much, Dr. Chu, for your time and just kind of just sharing your insights and just being vulnerable in sharing your journey through IVF.